Let's talk about stress fractures. I'm Dr. Richard. I'm a board-certified podiatrist. And did you know that stress fractures are small hairline cracks in a bone? And it's usually due to overuse injury. So that means doing too much too soon. Stress fractures can take up to 2 weeks to show up on an x-ray. So that's why when I have a patient with the clinical presentation of a stress fracture, like pain with walking, localized swelling, erythema, that's redness, pain that increase with activity, or pain on palpation of the fractured bone, I put my patient in a walking boot. And especially with my athletes, I don't want to delay treatment. So I order additional imaging to have the proper diagnosis. So that means either an ultrasound. This one, you can still miss the stress fracture because it's really dependent on who's doing that test. But what I prefer to order is an MRI. We'll see the fracture right away. Okay, treatment for non-displaced stress fracture. We'll start with proper nutrition. We need protein, calcium, vitamin D, vitamin C. These are all essential for bone healing. Then I will immobilize my patient in a walking boot and repeat x-ray every 2 weeks to see the progression of bone healing. So yes, at first immobilization is important, but bone is alive. So it will adapt to the pressure that it's applied on it. So it's also really important to do progressive load, progressive weight bearing, and that all depends on what the x-ray looks like. How long are my patient gonna be in a boot? Well, this one depends on which bone is fractured, the severity, and also the location, exactly where in that bone is the fracture. So for example, usually metatarsal fracture, patient will keep the boot for 4 to 6 weeks, and calcaneal fracture, which is the heel bone, will be more 6 to 10 weeks. After the boot is out, patient will be a little bit stiff. So really important to do physical therapy, to do exercise, stretching. We need to strengthen the muscle in your feet. And then I also always recommend to do a biomechanical examination, a gait evaluation to see the cause. Why did we get the stress fracture in the first place? And I usually also recommend different type of shoes for different patients, some strengthening exercise, and in some case, an orthotic.